Hi, my name is Emmeline Carrera, and I'll be doing the physical assessment right now. I'm getting ready of all my materials needed for the assessment, and I will go check my patient. Hi, good afternoon. My name is Emmeline, and I'll be your nurse practitioner for today. And what is your name?
My name is Laika Negre.
Hi, Laika. So we will be doing the um, history and the head to toe assessment and review of systems.
Alright.
And let me just sit here and so while I will be doing this, let me know if you need anything.
Okay.
If the temperature is okay, or if you feel anxious, if you're stressed out, just let me know and we'll just go through it
Alright.
one by one. If for some reason you need to go to the bathroom, just let me know, okay?
Alright.
So how old are you?
I am 21 years old.
21 years old. What made you come here to the clinic?
I have an earache.
And when did it start?
It started 2 days ago.
Is it in your right or on your left?
It's on my right
Or
ear.
both?
Just the right.
Just the right.
Mhm.
Can you describe it?
It feels kind of full. It's like constant. Yeah.
Okay, and do you have fever, runny nose, or sore throat?
No.
No. Does it go anywhere else? Does it radiate?
Oh. Like under the earlobe.
Just under the earlobe. Okay. How would you rate your pain in a scale of 1 to 10? 10 being the worst pain ever, 5 moderate, or 0 none?
5.
5. Okay. And is there anything that you do to help relieve the pain?
I drink some Tylenol.
Tylenol. And does it seem to help?
Yeah.
Does anything make it worse?
Not really.
No. Okay. Can you tell me about your past medical history?
Okay.
Have you been hospitalized or have been sick before?
No, I just went to urgent care because I twisted my ankle.
Okay. What about medical conditions you have? Do you have any medical conditions? And tell me about your last menstrual period.
I'm having my period right now.
You are. Okay. When was your last pap smear? Or have you done?
I haven't done it yet.
Okay. Have you had a mammogram?
No.
Okay. How about colonoscopy?
No.
And your last dental exam?
July, August of this year.
July or August of this year. And vision exam?
2 years ago.
2 years ago. Are you allergic to anything?
Yes.
Like medications or foods?
It would be egg and hydrocodone.
Egg and hydrocodone. And what kind of reaction do you have?
For egg, I get rashes. For hydrocodone, I vomit.
Okay. And do you take some medications currently?
I only take cetirizine and Benadryl,
Okay, about herbals or vitamins?
ashwagandha supplement, and then my multivitamin.
Okay, very good. Do you exercise?
Yes.
How often do you exercise?
4 times a week, about like 10 minutes.
Okay, very good. How about breast self-examination? Do you do one?
I don't know how to do it yet, so I don't.
Okay. How about your immunizations? Are you up to date?
Yes, I just need to get this season's flu shot.
Okay. So you had flu shot last year.
Mm-hmm.
When was it?
October.
October of last year. How about pneumonia vaccine?
No, I didn't.
No pneumonia. How about tetanus shot?
Yes.
Okay. Tell me about your immediate family.
Okay.
Your mom and your dad and their health status.
Okay. So my mother has diabetes, and she also had a history of breast cancer. My dad, he has high cholesterol and a fatty liver, he said.
Okay. How about your mom's parents?
My grandma, I'm trying to think. My grandma has diabetes as well. And then my grandpa also has diabetes. He did die from renal failure. Yeah, renal failure like when he was 72, 71.
Okay, so
Yeah.
he was 72 when he died from renal failure. And how about your dad's side?
I don't know my dad's side because he was adopted.
Okay. Do you have any brothers or sisters? Or
Yes.
do they have medical issues?
No.
No. Okay. How about family history of tuberculosis?
No.
No. Heart disease?
No.
No. Lung disease?
No.
Cancer?
Yes.
Okay, you just said your mom
Yeah.
has breast cancer. Okay. And diabetes?
Yes.
Yes. And hypertension?
Not sure.
Okay. Stroke?
No.
Okay. Cholesterol?
Yes.
Yes. And psychiatric illnesses?
No.
No. Okay. Let's proceed with the personal and social history.
Okay.
Tell me about your living arrangement. Who do you live with?
I live with my mom and my sister.
Okay. And do you have any pets?
Yes.
Okay. What do you have?
Like pets?
Yeah.
2 puppies and 1 cat.
Okay.
Okay.
Do you work? What do you do for a living?
I don't work. I am in school.
Okay. So you're a student. Do you do lots of traveling or driving?
No.
No. But every day going to school, home, when do you use seat belts
Yes.
when riding the vehicle? How about do you feel any hazards or you have concerns that you are being worried about?
No.
Okay. Tell me about your sleeping habits. How many hours of sleep do you get every night?
5 hours on weekdays, 10 hours on weekends.
Okay, you sleep a lot on the weekends.
I gotta take it back.
Okay. How about, do you feel rested after sleep?
Depends. On the weekends, yes.
Okay. Any difficulty falling asleep or staying asleep?
I wake up easily. Slightest sound, I am awake.
Okay. How about falling asleep?
No, I fall asleep easily.
Okay, very good. Do you go to church or do you have any religion?
I do have religion, but I don't go to church. I just go to the religious events of the church.
Okay, so you go to religious functions.
Yes.
Okay. Do you have any financial concerns?
Yes. Student loan.
Student loan. Okay. How about health insurance?
I do.
You have health insurance. Okay. Are you able to afford your necessities for everyday life?
Yes.
Okay. So you're able to eat and you have shelter and everything. Okay. Do you smoke or use tobacco products?
No.
No. Okay. Do you drink alcohol?
Yes.
What type?
I had whiskey like this August.
And how often?
Twice a year.
Okay. How about, do you do any recreational drugs
No.
or use substance abuse?
No.
No. Have you ever traveled outside the country?
Like in general or recently?
No, like for the past 6 months.
Okay. No.
No, or past 2 months, a couple.
No.
Okay. Have you ever served in the military?
No.
Okay. So we'll do the review of systems. Do you have a recent fever, chills? Are you being tired all the time?
No.
No. Night sweats?
No.
changes in weight,
No.
weight gain or loss?
Mm-mm.
Okay. Tell me about what you eat and drink.
I
What do you usually eat and drink?
For breakfast, sometimes I just get a cereal.
Mm-hmm.
But if there's test, I'll just get a candy, and then I'll eat a big lunch of like salad and then some chicken on the side. And then for dinner, I usually get rice and some veggies and then fish. Usually.
Okay.
Yeah.
So you think it's enough nutrition?
I hope so.
Okay. Any changes in your skin,
No.
hair,
A little bit thinning hair.
thinning hair? Is it because of stress
Yeah.
from school?
Yeah.
Okay. And changes in your nails, or do you have any skin issues?
No.
No. Okay. Wounds?
No.
How about moles?
No.
No. Any issues of your skin texture?
No.
Okay, very good. Do you have headaches or vision problems?
Just headache.
Headaches.
Not vision problems.
Okay. Do you wear contacts
No.
or glasses?
No.
Okay. Any injuries, head injuries, loss of consciousness?
No.
Okay. Or have you passed out before?
No.
No. Okay. How about your ears? You said you have earache in your right,
Yes, ma'am.
and do you have hearing loss?
No.
No. Do you still hear okay?
Yes, ma'am.
Do you see any drainage from that?
No.
Okay. Do you have nasal congestion,
No.
drainage,
Mm-mm.
bleeding nose?
Mm-mm.
Okay. Sore throat?
No.
No. Do you experience bleeding gums, or do you have ulcers?
No.
No. Okay. How about swallowing? Do you have any difficulty of swallowing?
No.
No. In your neck, do you feel any tenderness or lump?
No.
Okay. Any swollen lymph nodes you noticed?
No.
No. Okay. Do you have any cough right now, or sputum production?
No.
Do you have shortness of breath?
No.
No. Okay. For the cardiovascular, do you have any chest pain, palpitations?
No.
Okay. How many pillows do you use in your head?
One. Or
At night.
sometimes nothing.
Nothing.
I don't like
one
pillows on my
or
head.
nothing. Okay. You said you exercise and you tolerate exercise.
Yeah.
Do you exercise regularly?
I try.
Okay. Do you feel shortness of breath after exercise?
For like a minute, but I'm good after.
Okay. Gastrointestinal. Do you have, or do you feel indigestion?
Mm-mm.
No. How about heartburn?
Mm-mm.
Do you have nausea and vomiting?
No.
No. What about your bowel habits? How many times do you poop?
Once or twice every day.
Very good. No diarrhea or constipation?
No. I do not want those.
Okay. Do you notice any rectal bleeding?
Mm-mm.
No. How about abdominal pain or masses that you felt?
No.
No. With your musculoskeletal, do you see any swelling or redness in
No.
your joint, or do you
Mm-mm.
feel any pain?
Mm-mm.
No. Okay. How old were you when you had your menstrual period? When you
11.
first started? Okay. 11. Have you been pregnant?
No.
No. Any vaginal discharge or itching?
No.
Okay. How about lesions? Do you see any lesions there?
No.
Okay. Have you engaged in sexual activity?
Mm-mm.
No. So you have never been pregnant.
Mm-mm.
Okay. Any difficulty urinating?
No.
Or burning or urgency, frequency?
No.
No. Do you pee a lot at night?
No.
Okay. Do you see blood in your urine?
No.
No. Okay, how about your breast? Um, do you see any discharge from the nipple?
No.
No. You don't do
I don't know how to yet.
So you don't, but you don't feel any
No.
tenderness or lumps there? Okay. With your extremities or lower, do you see any discolorization or lymph nodes?
No.
Okay, so skin is dry and intact, no cuts, no wounds.
Mm-mm.
Do you do you bruise easily?
No.
No. Okay. Do you have any heat or cold intolerance?
I get cold easily.
Okay. Excessive thirst or urination?
No.
Okay. How about fainting or weakness?
No.
Okay. Do you have any psychiatric or mental health issues?
Yes.
Yes. Can you further explain about that?
I go to therapy for it. It's okay.
Oh, you go to therapy.
Yeah.
So you have already.
Yeah.
Okay. Very good.
Yeah. Just chill.
Now, let's proceed with our head to toe assessment. Let's do the skin. The skin is dry and intact, no wounds. The hands is symmetrical. Fingernails, they're not cyanotic, they're pink. Capillary refill is less than 3 seconds, and it's warm and it's dry. No lesions noted, and if I see a lesion, I will check the color, the size. If it is also raised, I will check, and I will use the ruler to measure. And if there is exudate, I will check for the color and the odor, and I will also check the distribution. And let me check your pulses, the radial pulse, it's regular, +2, and then the brachial pulse. And then assess for the range of motion. Let me check for of your hands. Can you do this? Okay. All right, and your wrist and your elbow. Oh,
Okay.
and your shoulders.
Okay.
And then let's assess for the strength. Can you push, pull? Yeah, push upward and then down.
Okay.
And then your elbows.
In, push in, or?
Yeah, and your wrist too.
Okay.
And then your elbows in, out, and then your shoulders. Okay. We'll do the reflexes of the biceps and the triceps. The biceps, and the tricep.
Do I need to roll up my?
Okay. Okay. And can you do also the, oh, let's do the brachioradialis reflex. Okay. And can you do the finger to nose?
So from my nose.
Yeah,
Okay.
touch my finger, touch your nose. And then the other hand too. Okay. Can you close your eyes?
Okay.
I will open your hands and tell me what you feel. What is this one?
It's a paper clip.
Okay. How about that?
Eraser.
An eraser. Okay. And well, let's also do the alternating. Oh, you can open your eyes.
Sorry.
You can do your alternating movement
Okay.
like that.
Okay.
Very good. And let me check your nodes, the axillary nodes, and epitrochlear nodes. Okay, now we'll proceed with the head and the face. The head is symmetrical and there I can't feel any lumps or nodes, and the hair is black, and there's a little thinning, but the skull is symmetrical, and the face, can you smile for me? Can you raise your eyebrows, frown, puff your cheeks? Cranial nerve number 7 is intact. And let me palpate your sinuses, the frontal sinuses, the maxillary sinuses, and I don't feel any nodes or masses. And let me percuss it. And it's normal. And let me auscultate for the temporal artery for Ruiz. Okay, and I will do the Hirschberg test for the eyes. Okay, the eyes are equal and round, and there is response to the light. And let me see for the consensual. Okay, very good. And there is accommodation, and we'll check, do the cover and cover if you can see there.
Oh.
Okay. Okay. It's normal, there's no deviation. And we also do the check for the all the fields, the 6 cardinal fields, okay? Just follow this one with your eye.
Okay.
Okay, very good. So the eye, there's no, I can see the external structure. It's no deformities, no redness, nothing like that. The conjunctiva is okay, and I can see the sclera, the cornea, and the iris, and I'll be checking it with a fundoscopic. The red reflex is okay. I can see the optic nerve and also the retina and the vessels. And let me go ahead with the ears. The ears are symmetrical, and there's no palpable masses or nodules. And I will stand 2 feet here and tell me what I say.
Okay. 3, 4, 5.
Okay.
ABC.
Very good. You can hear me right. And let me use the ophthalmoscope. Oh, not the ophthalmoscope, the otoscope to check for your ears.
Okay.
And it is intact. I can see the tympanic membrane that's silvery, and there's hairs and no abnormalities. And same here, the ear canal. We'll check the ear canal. The ear canal is clear and clean. There's hairs and the tympanic. I can see the tympanic membrane. And let's do the Weber test. Tell me where you hear it, okay?
Okay. The middle.
In the middle, okay. And also we'll do the Rhines test. We'll do the Rhines test bilateral.
Okay.
Let me know when you stop hearing it.
Okay. Stop. Stop.
Okay, it's normal. We will do the same too with the
Okay.
other
Alright.
ear, okay? But it's still the same. The air conduction is twice as the bone conduction. So we'll proceed with your nose. The nose is symmetrical. There's no drainage, and let me check. The nasal septum is normal, no nodes or anything. It's all good. It's patent, and it's color pink. And let me palpate it. There is no fracture or nodules, and we'll proceed with the mouth. Can you open your mouth for me? Okay, let me. The lips is okay. The mouth is color pink. The uvula is moving. Can you say and stick up your tongue? The tongue is normal, and no lesions, no ulcers, no bleedings, and the and cranial number 12 is normal. Let me put on my gloves and check the mouth. The gums is okay. Let me.
Okay.
Okay. Open. The mouth is okay. The gums, no bleeding. The teeth is 28 and no dental caries. And I also palpate the hard and the soft palate, and it's normal. And I'll also palpate the temporomandibular joint. Can you can you push your tongue? Tongue is strong. Let me check your tonsils. Can you swallow? Very good. The neck is the skin is dry and intact, and inspect it. It's symmetrical. There's no lumps or pulsations. And check for the preauricular nodes, posterior auricular nodes, submandibular nodes, and submental nodes, superficial cervical nodes, and the deep cervical nodes, the tonsillar nodes, and the supraclavicular nodes. And let me auscultate for your carotid pulse. Very good. And let me palpate. And your trachea. Trachea is okay. Can you do this range of motion of your neck? Okay. And can you push against my hands? Okay. Now let's proceed to can you
Okay.
Go there. I mean,
Move my hair out.
face there. Okay. Now let the the back, the thoracic cage is the size, the transverse diameter is twice as the AP diameter. The skin is clean, dry, and intact, no lesions, no retractions, heaves, or dyspnea, regular breathing, it's symmetrical, and let me palpate. Can you deep breath for me? Okay, and it's symmetrical. And can you say 99?
99, 99, 99, 99, 99.
Okay, and I will, and let me percuss. And let me auscultate. You see, you say E,
E, E, E, E, E, E.
okay. And I will also auscultate your breath sounds. The breath sounds is clear, no crackles, and respiration is about 16. And let me check for here in the front. The chest is symmetrical. Respiration is about 16 beats per minute, and skin is dry and intact, and warm to touch. No lumps or tenderness. Skin turgor is brisk, and we assess for the breath sounds. Take some big deep breaths. Okay, now can you lay flat here?
Okay.
Okay, the precordium, no, there's no pulsations or heaves, and there is no masses or nodules, and will let me check for the auscultate for the rhythm. Your heart sounds in 5 different areas. I will check using the diaphragm. and the aortic, second intercostal space, right sternal border, pulmonic area, second intercostal space, left sternal border, Erb's point area, third intercostal space, left sternal border, tricuspid area, fourth intercostal space, left sternal border, and the mitral or apical area, fifth intercostal space, left sternal border. And I will check it for the whole minute. The rate is regular, it's 78 beats per minute. And now I'll be checking it again using the bell of the stethoscope. Aortic area, second intercostal space, right sternal border, pulmonic area, second intercostal space, left sternal border, Erb's point, third intercostal space, left sternal border, tricuspid area, fourth intercostal space, left sternal border, mitral, apical area, left, fifth intercostal space, left sternal border. And now, let's proceed with the abdomen. Let me, yes, open your abdomen for just a little bit. Let me check. No pulsations, skin is dry and intact, and no wounds, no lesions noted, and no nodules or masses observed, and the skin is intact, and it's symmetrical, and the contour is normal. Can you raise your hand? Okay, the contour is normal, and put it down.
Okay, thank you.
And let me auscultate the bowel sounds using the diaphragm. Okay, the bowel sounds are normal, and I will also auscultate the vascular sounds using the bell. The aorta, medullary, the femoral, and renal. Okay, and let me percuss all the 4 quadrants.
Okay. That sounds strong.
It's too funny.
It sounds so goofy, but that's okay.
Okay, and now I will do light palpation and deep palpation. And I will also do the scratch test for the liver. Okay. And I'll also do the deep palpation.
That's deep.
And I will palpate the liver.
Okay.
And the spleen. And it's not palpable, which is a normal finding.
Okay.
Okay, and liver and the spleen. And now let's proceed with your lower extremities. If you can sit here. And the skin, it's intact and it's symmetrical, and hair distribution is normal, and make the legs for edema, which is normal. And I'll check the pulses, dorsalis pedis, and the posterior tibia pulse. And can you push, pull? Okay, and your toes is,
My feet are cold, it's okay.
sorry, there's no cyanosis, it's pink. The capillary refill is less than 3 seconds. And let's do the range of motions of your, can you,
Back down?
yeah,
Okay.
sorry.
It's okay.
And you already push, pull. Can you slide this heel up and down your shin?
Oh, okay.
Up and down your shin, up and up to the
Oh,
knee.
like that?
Yeah, and then the other.
Okay. I'm sorry.
Slide it.
Oh, slide like that?
Yes, and
Okay.
down. Okay, and let me do the Lachman's test. Okay. Okay, and do the other one. We'll check for the ACL. And let's also do the okay, that one. push against my hand,
Oh, okay.
and then
The other side?
the other side
Same
too,
position?
same.
Okay. Alright.
Okay. And yeah, the
Wiggling my legs.
okay. And range of motion and your leg up, side.
And the other side.
Side.
Sorry, I don't want to make
It's okay. And let me check your Achilles reflex.
Do you want me to sit down on
No, I think this is okay.
Okay. That tingles.
And your Babinski reflex. Okay. Now, can you stand?
Stand?
Yeah.
Okay.
Stand. Your skeletal is okay. Your okay. Your cervical, lumbar, and gluteal folds is symmetrical in normal curvature. And can you walk? Can you walk going here or there? It's fine.
Okay.
However you want to walk.
Okay.
Walk normally.
Alright, I look like a penguin.
Okay, walk normally.
Alright.
Normal gait. And walk with your heels.
My heels. Okay.
And back with your toes.
Tiptoe?
Tiptoes. Okay. And then close your eyes.
Okay.
And then just close your eyes and okay, and she's not falling. That's the Romberg sign. And can you bend your knees?
Bend my knees.
Yeah.
Oh,
Okay. And posture is okay. Curvature, cervical, thoracic, and the lumbar. And your scapula is equal, and iliac crest and gluteal folds normal. And can you bend?
Like
Yeah.
like that? Okay.
And the spine is okay. And then so to check for the, did I tell you earlier for the oh, you can open your eyes.
Okay.
To check your what do you call this one? The memory test.
Oh no.
The short term and the long term.
Oh.
Okay, for the long term, you're not from the United States, are
Okay.
you?
No.
Where are you from?
In the Philippines.
From the Philippines. So, who is the first to check for your long-term memory? Who is the first lady president of the Philippines?
Oh, Cory Aquino.
Okay, you are right. And did I tell you some words earlier, or do you remember? I did not tell you.
Don't remember.
I think I did not tell you, so you remember that I did not tell you. So
Oh, okay.
that's a good thing. That's a short memory. And I think that's it. Thank you so much for participating.
Thank you so much.
And I hope you enjoy the short physical assessment.
Alright, thank you. I do.
Thank you.
Thank you.